Good morning. Welcome. My name's Stacy Silverman, and I'm the Deputy Assistant Commissioner in the Division of Academic Quality and Workforce here at the Coordinating Board. On behalf of the Texas Higher Education Coordinating Board, it's my pleasure to welcome everyone and convene the Texas Child Mental Health Care Consortium. As we begin our meeting today, please be aware that this meeting is being broadcast via the internet. So at any point, any of us, including some of you in the audience, may be visible to anyone watching online. Also, as a reminder, please silence your cell phones and computers. Additionally, this is not a telephonic meeting, so external folks may listen but may not participate in the meeting. So a couple of housekeeping items. The restrooms are located out the back doors and to your right. Also, if you need a snack or water, there's a break room out the back and to your left. At this time, I'd like to invite the Coordinating Board's Director of External Relations, John Wyatt, to review the provisions of Senate Bill 11 from the recent legislative session that created the consortium. John? Welcome.
Thank you. Good morning. My name is John Wyatt. I am Director of External Relations here at the Coordinating Board. So in that role, I work with the legislature in terms of higher education policy and funding. I'm going to present a bit of a brief overview over what exactly it was the legislature enacted in regards to the consortium this session. So there were really two major components to what the legislature did, the authorizing legislation and then the funding rider. So you may have heard the legislation referred to as both SB 10 and SB 11. SB 10 was the vehicle for the majority of the session. Ultimately, that was added as an amendment to another piece of legislation, SB 11, and that was the bill that was actually signed by the governor on June 6th. So SB 11 establishes the consortium statutorily. It defines the governance of the consortium, the purposes of the consortium, as well as the major initiatives and duties of the consortium. There's also the funding component. So HB 1, which is the General Appropriations Act, the state budget for fiscal years 2021, includes $99 million for supporting the work of the consortium. There's also a budget rider in the Coordinating Board's budget. That's Rider 58. And the rider further defines how those funds may be spent. And I'll go into that in a little more detail in a second. So SB 11 defines the consortium's purpose. There are two purposes that it lays out. Leveraging the expertise of our health-related institutions to address urgent mental health challenges and improve mental health care systems in relation to children and adolescents, and to enhance the state's ability to address mental health care needs of children and adolescents through collaboration of our health-related institutions. In order to achieve this purpose, the SB 11 lays out a structure for the consortium. So there's both the consortium and then an executive committee defined in the bill that is the governing body of the consortium. So the consortium itself is composed of 13 specified HRIs, the Health and Human Services Commission, the Coordinating Board, 3 nonprofit organizations focused on mental health care. Now, the legislation itself does not say what those organizations are to be. That's to be designated by a majority of the health-related institutions in the consortium. The legislation also provides that the consortium may include any other entity that is approved by the executive committee. As I mentioned, there's an executive committee that governs the consortium. The legislation specifies who is to be on that committee. So it's to include the chairs of psychiatry from the 13 HRIs, although each chair may designate a licensed psychiatrist to serve in his or her stead. 2 representatives from the Health and Human Services Commission. That's to include one with expertise in the delivery of mental health care services and one with expertise in mental health care facilities. A representative from the Coordinating Board, a representative from each of the 3 nonprofits that are added to the consortium, A representative of a hospital system, and that representative is to be determined by a majority decision of the HRIs in the consortium, as well as any other representative designated by a majority of the HRIs at the request of the executive committee. In addition to these representatives, there is the option for the president of each of the 13 HRIs to designate a representative to represent him or her on the executive committee. In terms of how the consortium is to be administered, under SB 11, the consortium is administratively attached to the coordinating board. Now, the purpose of that is to allow the state to appropriate funds to the coordinating board, and then the coordinating board will transfer those funds in line with the decisions and directives of the consortium. So this allows the coordinating board to act as a bit of a fiscal pass-through entity for the decisions that the consortium will make in terms of how to expend that $99 million. The legislation also states that the board is not responsible for providing staff, human resources, and other administrative support services to the consortium. For that purpose, the budget rider includes $1.5 million to be transferred with the approval of the LBB to an institution of higher education so designated by the executive committee. And I'll go into that in a little more detail in a second. So SB 11 also establishes specific initiatives that the consortium is to support, subject to the provision of state appropriations. Those include establishing a network of comprehensive child psychiatry access centers at HRIs to assist pediatricians and primary care providers, to establish and expand telemedicine and telehealth programs for identifying and assessing behavioral needs with a focus on at-risk children, to fund additional full-time psychiatrists to serve as academic medical directors at community healthcare centers, as well as to fund additional residency positions, and to fund fellowship positions at HRIs that will lead to a medical specialty in psychiatric and associated behavioral issues affecting children and adolescents. So again, SB 11 sets up the structure. HB 1 actually provides the funding during this coming biennium to implement these initiatives. So HB 1 provides $49.5 million in fiscal year 20, as well as $49.5 million in fiscal year 21 to implement the consortium. There is a UB authority between the years of the biennium, so that any funds not expended in the first year are allowed to carry over into the second year. As I mentioned, the rider requires that $1.5 million be transferred to an institution for administrative support of the consortium. The rider requires that be done by September 1, 2019. So that's a decision point you have today in terms of identifying what that institution is going to be. The rider directs the consortium to implement the 4 major initiatives that I discussed on the last slide. It does not specify in what amount those initiatives are to be supported. So again, that's a decision that the consortium and the executive committee is going to have to make in terms of how to allocate funds among the different purposes of the consortium. And then probably most importantly, the rider requires that by November 30th, the consortium submits a plan to the LBB to implement the initiatives identified in rider and statute. The rider says that no funds may be expended without the prior approval of LBB, and the plan as submitted takes effect automatically if not denied by LBB within 30 days. So that's kind of the major work that y'all are going to have to accomplish between now and November 30th. So those are the major elements of what the legislature enacted, and I'm happy to answer any questions.
Thank you, John, for that review. Let's move on to agenda item number 3. In July, Commissioner Paredes sent a letter to each higher education institution and agency identified in Senate Bill 11, requesting their participation in the consortium. Additionally, the President and the Commissioner of Health and Human Services were asked to provide the names of their appointees to the consortium's executive committee. At this time, I would like to acknowledge each of the institutional members of the consortium And I'll start with recognition of the health-related institutions of higher education. Baylor College of Medicine, Texas A&M University System Health Science Center, Texas Tech University Health Sciences Center, Texas Tech University Health Sciences Center at El Paso, University of North Texas Health Science Center at Fort Worth, the Dell Medical School at the University of Texas at Austin, the University of Texas MD Anderson Cancer Center, the University of Texas Medical Branch at Galveston, the University of Texas Health Science Center at Houston, the University of Texas Health Science Center at San Antonio, the University of Texas Rio Grande Valley School of Medicine, the University of Texas Health Science Center at Tyler, and the University of Texas Southwestern Medical Center. Next are the state agencies which include the Texas Health and Human Services Commission and the Texas Higher Education Coordinating Board. In the Commissioner's letter to the institutions were asked to confirm that the following 3 nonprofit organizations that focus on mental health would also be members of the consortium. A majority of the presidents affirmed that the membership on the consortium of the following organizations: the Hogg Foundation for Mental Health, Meadows Mental Health Policy Institute, and the Texas Council of Community Centers. Some institutions also made suggestions of additional nonprofit organizations. These included the El Paso's Behavioral Health Consortium, Paso del Norte Health Foundation, Integral Care, and Clarity Child Guidance Center. No action will be taken at this time related to these organizations, but the Executive Committee, once it is established, may take action later in this meeting or at subsequent meetings to add representatives of these or other organizations to the Executive Committee. Next on the agenda is Agenda Item 4, the consideration and establishment of the Consortium's Executive Committee. It is my pleasure to welcome the new members to the Executive Committee. In the interest of time, I'll begin with items 4A and H, which are the representatives from the institution of higher education. These include the chairs of the academic departments of psychiatry of each of the health-related institutions listed in Health and Safety Code, Section 113.0021, or a licensed psychiatrist, including a child adolescent psychiatrist designated by the chair to serve in the chair's place, along with a second official from each of the listed health-related institutions designated by the president pursuant to Health and Safety Code Section 113.0101B, who will be referred to as a delegate. Note that under the provisions of the Health and Safety Code that address the composition of the Executive Committee, the representatives of the academic departments of psychiatry of the health-related institutions have the authority to vote to name the members of the Executive Committee not already designated by statute. I'll list the institution followed by its representative and delegate. Baylor College of Medicine will be represented by Dr. Wayne Goodman, Chair of Psychiatry, and also have a delegate, Dr. Laurel Williams. Welcome. Texas A&M University System Health Science Center is represented by Dr. Israel Liberzon and delegate Dr. R. Andrew Harper. Welcome. Texas Tech University Health Sciences Center is represented by Dr. Sarah Wakefield and delegate Mr. Keno McWinney. Welcome. Texas Tech University Health Sciences Center at El Paso is represented by Dr. Peter Thompson and delegate Dr. Sarah Martin. University of North Texas Health Science Center at Fort Worth is represented by Dr. Alan Podowitz and delegate Dr. Mark Chasey. The Dell Medical School at the University of Texas is represented by Dr. Charlie Nemiroff and delegate Dr. Stephen Strakowski. The University of Texas MD Anderson Cancer Center is represented by Dr. Daniel Tan and Delegate Dr. Rhonda Robert. The University of Texas Medical Branch at Galveston is represented by Dr. Karen Wagner and Delegate Dr. Alexander Vo. The University of Texas Health Science Center at Houston is represented by Dr. Jair C. Soares and Delegate Dr. Elizabeth Newland. The University of Texas Health Science Center at San Antonio is represented by Dr. Stephen Piltzka and Delegate Dr. Joseph Blader. The University of Texas Rio Grande Valley School of Medicine is represented by Dr. Michael Escamilla and Delegate Dr. Michael Patriarca. The University of Texas Health Science Center at Tyler is represented by Dr. Jeffrey Matthews and Delegate Dr. Daniel Deslade. And the University of Texas Southwestern Medical Center is represented by Dr. Carol Taminga and Delegate Dr. Hikram Ibrahim. Welcome to all the new members. Good morning. Next on the agenda is agenda item 4B, appointment by the Commissioner of Health and Human Services with expertise in the delivery of mental health care services. Welcome, Sonia Gaines. The next agenda item 4C is the appointment of the Commissioner of Health and Human Services with expertise in mental health facilities. Welcome to Mike Maples, who is right
In the
here.
corner.
Sorry. Welcome, Mike.
Thank you.
Nice to see you. Next on the agenda is 4D, the Commissioner of Higher Education's appointment, which is me, Stacy Silverman. Thank you. I appreciate that. All right, agenda item 4E is the appointment of a representative from the 3 nonprofit organizations named earlier pursuant to Health and Safety Code Section 113.0101A5, which will require the now appointed representatives of the health-related institutions to vote. The representatives from these organizations are Dr. Octavio Martinez, Executive Director of the Hogg Foundation for Mental Health, Dr. Andy Keller, President and Chief Executive Officer of the Meadows Mental Health Policy Institute, and Ms. Danette Castle, Chief Executive Officer of the Texas Council of Community Centers. May I have a motion to elect these representatives to serve on the executive committee? I had a motion by Dr. Podowitz and a second by Dr. Stravowski. Sorry. I appreciate your kindness. All in favor? Motion passes. Welcome to these members. On to agenda item 4G, the appointment of a representative of a hospital system in this state which pursuant to Health and Safety Code Section 113.01016 is to be designated by a majority of the representatives of the health-related institutions. 2 nominations were received and copies of the letters and their CVs were sent to you all prior to the meeting. These include Baylor Scott and White's recommendation of Dr. James Bourgeois and Danielle Wesley from Children's Health. May I have a motion to elect a representative from a hospital system in this state to serve on the executive committee? Dr. Taminga. Sure. We need one motion to nominate one representative.
I will nominate Danielle Wesley. I would suggest that she be nominated.
Is there a second? All right, there's a motion and a second. All in favor? Need a raise of hands. All right, motion passes.
Nominate myself.
Okay, we need to do that down further on the agenda.
Tell me what it is.
Okay, you got it. So welcome to the hospital appointee. Right there. Oh, welcome, Danielle. Next, I'd like to skip ahead to agenda item 6, and then I'll come back to agenda item 4H. So agenda item 6 is the discussion and consideration of approval by the Executive Committee of the designation of an institution of higher education to serve as the administrator of the consortium. Is there a motion? Sorry. Now I've gotten out of my... No, we are not. We're waiting on that right now. But first, we're going to go ahead and do the nomination for the executive committee, the administrator, the actual named institution. May I have a motion? Yes.
Yeah, who are we nominating?
Yes, we could. We're actually nominating the chosen institution to be the administrator for the consortium, to serve as the administrative entity.
I'm wondering, did we get any interest in that from multiple sources or just one source?
We did not. We got one source of interest. Yes. There's a motion on the table to nominate the University of Texas System Office to serve as the administrator to the consortium. And I have a second. Any questions? Discussion? Yes? Yes, it is the system that oversees the 14 component institutions that comprise the University of Texas. Not at this point.
And
Do I
if
have a
people-
motion and a
just as
second?
civil, if people could use their microphones, because it's hard to hear across the table.
Thank you, that's a good point.
Does UT System want to administer this consortium? They're not here, right?
They are, in fact, here in the audience, and I'm sure they could speak to this point if needed.
So can you speak to that?
If we were asked by the consortium to administer it, we would be happy to administer it.
Okay.
We have a nomination and a second on.
That's correct. So we can vote at this time. All in favor of the motion? Fabulous. So the University of Texas System Office will serve as the administrator of the consortium and its executive committee. Now I'd like to return to agenda item 4H, which is consideration pursuant to Health and Safety Code of any other representative to serve on the executive committee to be designated by a majority of the representatives of the health-related institution if requested by the executive committee. Please note that any executive committee member may make a motion. Are there any motions to name other representatives to the committee?
So pursuant to the last discussion, I'd like to nominate David Lakey.
Not for this.
Can we hold off on that
Oh,
one?
okay, sorry.
Right.
No, we're on H.
Yes, we're on H.
These are the presidents, the representative of the presidents.
No, sorry, that's not H. We should be on G. It's my bad. That's my typo. Yes, you can. So yes, at this time you may make that motion. I was confused.
H is the president, so I nominate that we add David Lakey to the commission since his organization is administrating it.
All right, there's a motion. May I have a second? We have a motion and a second. May I have a vote related to David Lakey? Please join us at the table. Yes. Yes, yes, we do.
I would like to nominate myself as a committee member. I'm Chair of Psychiatry Baylor Scott and White.
Yes.
We have a
As an executive committee member now, could I nominate
Dr. James Burgess to be a member of the executive committee.
Absolutely.
We have a second from Alan.
All right, great. We've got a motion and a second. Any discussion, any questions? May I have a vote? A vote.
All those in favor?
All those in favor say aye, or signify something like that. All right. Thank you, John. Keep my parliamentarian straight in order. Next on the agenda is Agenda Item 5, election of a presiding officer of the Executive Committee. May I have a motion to elect a presiding officer?
I move to nominate Dave Lakey.
All in favor? Motion passes. Congratulations, Dr. Lakey. At this time, it is my pleasure to turn the meeting over to the presiding chair of the Executive Committee, Dr. David Lakey.
Well, thank you, Dr. Silverman, and thank you, members. It really is an honor to be
Do we have a
selected to be
nameplate
part
for
of this
Lakey?
committee and be presiding
Yeah, we do.
I'll go grab it.
Those that are- Is my microphone there? Let me start again, because I don't think I had my microphone on. Thank you. It really is an honor to be part of this group. I've been able to work with most of the folks around this table now for 4 years, as we've tried to figure out how do we improve mental health services in the state of Texas, partnering with state agencies, philanthropic organizations, and all our academic institutions across the state of Texas. And we're committed in the University of Texas system to continue that theme of interinstitutional collaboration. And as the host institution for this, really want to make sure that this is successful. And the only way it's going to be successful is if we really partner together and work across our systems in a coordinated fashion, putting the good of the citizens of Texas at the forefront. So it really is an honor, and thank you for this opportunity. With that, I guess I will move forward with the meeting. And the first item that we have now is the review of the agreement between the Higher Education Coordinating Board and the University of Texas system to serve as the administrator. There has been conversations between the legal team at the University of Texas system and the legal team at the Higher Education Coordinating Board to make sure that that both institutions are comfortable with the agreement between the two, that there's accountability there, and we want to make sure that there's transparency there between, with everyone related to what this agreement will look like. Do we have, is your counsel from Higher Education Coordinated Board? I guess everyone has a copy of the agreement in what was sent out to the consortium members yesterday, right?
That's correct. So yes, and I'll just chime in. We've been in discussions, developing the agreement, and it is going to hopefully move through the process rather quickly. I know earlier there was a mention of a deadline. There actually is in the rider a deadline for us to transfer $1.5 million, $1 million in fiscal year 20 money, and $500,000 in 2021 money to the consortium, to the administrator of the consortium, which would be the UT system office. So as soon as that's completed, we'll go ahead and route it internally. What happens is that we'll send the agreement out to the institution, they'll return it back to us, we'll have signatures on it, and then we'll move for the transfer of funding so that an administrator can be in place and can be supported, and really to support you all in the work that you're doing. I guess I'm included in that group as well. So, great.
Do we need a motion to move it from here to the next step?
I think it would be helpful if folks have had a chance to review the agreement between the University of Texas system and the Higher Education Coordinating Board. If you feel comfortable with a motion of moving that forward, I think that would be helpful as we gain LBB approval to move forward.
So moved.
Okay, I have a motion by Alan, second by Dr. Chassé. Any additional conversation? All in favor of moving forward with this agreement, signify by raising your hand. It is so moved and passed. So Stacy, the next item, as I'm looking at the agenda, is lunch, but it's only 10:30. Would anybody be opposed with me just plowing forward with the agenda?
Mind it all.
All
And
right.
lunch will be here at 11.
Okay.
So, hopefully.
So as we were reviewing this information, and the bills that were passed and the legal statute related to the consortium, it became clear to our legal team that we are under the Texas Open Meetings Act and the Texas Public Information Act. And so want to make sure that that information is clear to all members of the executive committee. And David Lean from the legal team at UT System has been going through that. And just to be honest, it's a little bit complicated because of the variety of members that we have around this table. But wanted to give a preliminary briefing on how that's pertinent to this group, and maybe at a subsequent meeting go in more detail related to how are we really going to abide by both the Open Meetings Act and the Texas Public Information Act. But wanted to get that on the table from the very beginning. David?
Morning. My name is David Lean, and I'm from the Office of General Counsel at the UT System. I've handed some handouts that will be making their way around the table. And what I'm going to give you right now is just a very brief overview of the Texas Open Meetings Act and the Texas Public Information Act. When you walked in this morning, you may not have realized that you were committed to complying with both, but we went ahead and had a vote appointing you to the executive committee before telling you, and now you're committed. And so for some of you, for many, most, almost all of you, this will be familiar to one degree or another. If you're at a public institution, you probably have come into contact with one or both of these statutes at some time or another. If you're at a private institution, you may never have come into contact with it before, and so this may be different for you. I want to tell you that it's going to be okay. These are not rocket science. They are important, and you need to be mindful, and you need to be a little bit careful, but they are not minefields, all right? I'm going to start with the Texas Open Meetings Act. And the Texas Open Meetings Act governs the manner and the times in which you may meet and deliberate the important public business that you've undertaken this morning, and how you can act on that public business. I'm going to skip to the dramatic conclusion of my piece on the Open Meetings Act right now and tell you that there is training available to you put on by the Texas Attorney General. And in fact, it is not just available to you. For each of the members of the executive committee, it's mandatory. And so the statute says that within 90 days, you need to go online, and the handout that should be making its way around to you, I give you the website address at the Texas Attorney General's website where that training is available. You watch it. It takes an hour. It's not scintillating, but it is detailed and it is clear. And at the end of that hour, I'm going to ask you to print a certificate of completion, and it's very easy to do that, assuming that you have a working printer with ink in it, and then return that certificate to Dr. Lakey. And we are required to hold on to those in the event that the Attorney General calls and asks to see them. Okay. So this is going to sound obvious, but the Texas Open Meetings Act requires that you deliberate and act on official business in an open meeting, such as the one that we're holding today. And an open meeting happens when the consortium gives notice to the public that an open meeting is going to occur, ordinarily 72 hours ahead of time. An agenda is posted, and it states the matters that you'll be discussing. If you hold an open meeting and you have not noticed a matter for discussion, as a general matter, you cannot discuss it. Right? So if you haven't spoken with Dr. Lakey or whoever is responsible for putting together and posting the notice about something that you wish to bring up at the meeting, if you haven't told him and it hasn't made its way onto the notice, we can't talk about it. So if, in the event, you do have items that you think he may not be aware of, or whoever is responsible for the notice is not aware of, make that person aware at least 72 hours ahead of time so that notice can be posted properly and you can talk about it. To hold an open meeting, you have to have a quorum. And you're probably going to talk a little bit when you discuss the governance plan for this organization in a bit about what constitutes a quorum. Unless you set some other number, that number is a majority of the executive committee. So if you have, for example, 31 members of your executive committee, I don't actually know, I lost count, of what the exact number is, you would have a quorum at 16, right? When you have 16 or more of you together, to discuss consortium business, you must be in a properly noticed open meeting in a public place accessible to the public, okay? So you can't gather in a quorum outside of the meeting to talk about public business. I'll skip to what's truly the dramatic conclusion is that if you violate the Open Meetings Act in that particular way, and in a couple of other ways that the Attorney General will set out for you, you may be subject to civil and indeed criminal penalties, okay? I have yet to see somebody actually go to jail for it, but it has happened. For those of you who recall the Sharpstown scandal, that was sort of the genesis of the Open Meetings Act, and every so often somebody gets in trouble for you. But again, it's not a minefield. I tell you that only to encourage you to take it seriously. You also can't, and if you've ever heard the term walking quorum, you also can't meet in small numbers, knowing that those overlapping small numbers will eventually result in a quorum, okay? And these outside open meetings, it doesn't matter whether you do it in person, whether you do it by email, or whether you do it by some other virtual method, right? So you can't have, as you may be accustomed to in your personal life, long email chains where people sort of duck in and duck out, contributing their thoughts to the conversations in a way that you know will end up constituting a quorum in violation of the Open Meetings Act, okay? Again, you're going to be able to comply with this. It's going to be okay. Now, you may suspect, those of you who've never encountered the open meetings, and you would be right, that there are going to be certain circumstances in which you have to meet in a closed session. If you've ever attended, and maybe you have, maybe you haven't, if you've ever attended a city council meeting, you know that from time to time they go into what is sort of loosely called executive session or a closed meeting. And those are things that the Open Meetings Act allows you to do by law. There are narrow exceptions. For example, if you wanted to meet with your attorney, you're not going to be purchasing real estate, but there are some opportunities to discuss negotiations of real estate purchases or personnel matters. There are specific exceptions. The important thing to note for you there is that you have to know what the reason is before you go into closed session. You have to post it, and then you have to announce to the public why you're going into closed session, the legal basis, and then you can clear the room, have your discussion, and then come back into open session, and only then can you act on anything that you may have decided in closed session. Make sense? All right, again, as I said, take the 1-hour training. If I have been, and I likely have been, unclear in any particular respect, the Attorney General will make it more clear. There will be help available to you. We will make help available to you as you go about your business. This is, for better or worse, probably not the last time you'll hear from me. And we're gonna make this work for you. I hesitate to give detailed legal advice, but I'd love to answer questions if I can. Yes, sir.
If you've already taken that, do you need to take it again?
If you could, I'd love for you to take it again, but if you've done it recently, just send us your certificate of compliance. And if it is recent, that's great. If it's not, I have to ask you to go ahead and do it again. Anybody else? Terrific. All right, let's talk briefly about the Public Information Act, which is a little more, requires just a little more coordination to comply with. Again, those of you in private institutions may never have encountered the Public Information Act and may be surprised to learn that you have to comply with it now. But now that you are in your capacity as a member of this consortium, you're going to have certain responsibilities. The business that you do, the information that you create in your work with the consortium may be public information. There are certain things that are accepted in the statute, and I'll talk about a few examples of that. I can think of several that apply here, and that especially those of you who practice medicine will have at the top of mind. I want to reassure you that there is going to be a way to protect a lot of that information from public disclosure, because you couldn't do your work without protecting a lot of that information from public disclosure. But as a general rule, the Public Information Act requires that the information you create in the public business you do with this consortium must be disclosed to the public upon delivery of a proper request. And question that often comes up about public information. It is the nature of the information that renders it public. It's not where you store it, and it's not the email address that you send it from. So you may have a personal device. You may have a phone. In fact, I'm going to go ahead and bet, I'm going to go out on a limb and say you all have a phone. And you may text from time to time. If you use your personal phone and you text about consortium business, there is a good chance you are creating public information that is subject to disclosure. You know, without seeing the particular request and without seeing the particular text message, I can't tell you today. But just know that you may be doing that. If you have a personal email address that you use only from home and ordinarily only for personal business, but you send emails related to your work for the consortium, you may be creating public information. Again, I need to see the particular request and the particular email, but just know that that's possible. And so I want to encourage you now to segregate the information that you create for consortium business. It's going to make your life, and it will in all likelihood make my life easier if you do so. That may mean keeping a particular folder for your work email address. It may involve creating an entirely new email address. Nothing requires you to do that. Again, it's the nature of the information, not where it comes from. But whatever steps you can take to segregate the information that you create for consortium business will help you down the road. That's not to say that you can't discard some information that you create in doing consortium work. As a general matter, I want you to err on the side of preservation, but what the statute refers to as transitory information, you can discard. If you take notes in preparation of a final draft, of a final document, you can discard those. If you are taking notes today, but you are not the person responsible for keeping official minutes, you can discard those notes, okay? So it's not every piece of paper, but it's a general rule, what you create, you should preserve, because it may be subject to disclosure. Draft documents, right, in anticipation of a final document, ordinarily can be discarded as transitory information. I'm going to tell you a little bit about how the public information request process works, not because I want you to memorize these deadlines, but because I want you to know that it actually moves pretty quickly. We're going to designate a person to receive public information requests from the public. Anybody can request information for any reason. In fact, we're not permitted to ask people why they want it. We have to receive the request and act appropriately. We receive a request. That person, whoever that is, receives a request. And within 10 days, we have to decide whether or not to withhold anything subject to that request. We can only withhold it if it's subject to one of the exceptions under the statute. Those exceptions include information made confidential by law. So the personally identifiable health information that you have in mind is confidential, but we have to tell the Attorney General we intend to withhold it. And the Attorney General gets the opportunity to tell us whether we're right or whether we're wrong. Within 5 days of telling the Attorney General, so within 15 days of request, we have to brief that request and provide at least representative samples of what we intend to withhold. That means that when we receive a request, we will be calling you almost immediately, if not immediately, to get with you to talk about the information that you have. And that means that you're going to need either you or your designee is going to be able to need to access it very quickly. And that's why it's helpful to segregate it, because if you have to go to 15 sources, imagine a request that somehow encompasses information at each of your institutions. It's already a huge job. If you have to go to 15 different places to find it, then you can see that I think we start to get into fractal geometry. It's so difficult, right? So segregate it, because we only have 10 days to seek the Attorney General's permission to withhold it. Beyond that, if we don't like the Attorney General's decision, if we think that we have grounds for appeal, we can go to district court. The requester, if the requester doesn't like the Attorney General's decision, the requester can go to district court and appeal. Right. There is also training available on the Public Information Act. It is not required by statute except for your public information coordinator, the person that is designated to receive these requests. It's available in the same place as the training on the Open Meetings Act. You may want to take it, especially those of you from private institutions, just to learn a little bit more about your responsibilities. But that's all that I've got today. Thank you so much for your time. Looking forward to doing this important work with you.
Thank you. Are there any questions for David? Carol?
Is public just the citizens of Texas, or can somebody from Massachusetts or Ohio request information?
You know, I don't know the answer to that question off the top of my head. I believe that it is irrespective of your citizenry. I don't think it is just for the citizens of Texas.
Other questions? Obviously, this makes it a little bit more complicated than our previous meetings when we had our chair of psychiatry meeting, but we've just been entrusted with almost $100 million, right? And we need to make sure that we are very transparent about how we're using those dollars for the service of Texans. And so, formerly worked with DSHS, I've worked with state institutions, I've always been under the Public Information Act, and you learn how to work with it and make sure you can get that information in when it's requested. And if there are real reasons, as listed here, why that information shouldn't be public, we need to be able to work on that very quickly to be able to get that cover. But at the same time, want to make sure that the people of Texas and the legislature of Texas feels very comfortable that we're playing straight up between institutions and are being good stewards of these funds and this trust that we've been given. Okay. Any questions? David, I may have you sit here with me for a little while, if that's okay.
Absolutely.
Okay. So, yes.
I have one question.
Yes.
I think this probably won't end up being an issue for this group, but if we were seeking an exemption and submitting to the Attorney General our rationale for that, you said you would have to send representative samples of information that you would be withholding. So, for example, in a circumstance in which it was health-related information that you were talking about, what kind of representative sample gets submitted in that kind of situation?
If one document is enough to get the point across, so if it's a health record, right, for example, we might submit it, we might contact the Attorney General's office to make sure that we're submitting it in a form in which they can make their decision. Even then, we would want to talk about redacting, but just enough so that they can understand the reason that we're withholding it. A true health record we could probably withhold even without the sample upon sufficient discussion with the Attorney General's office, but that's the idea.
Thank you.
Other questions? All right. Again, thank you, David. Let's move on to item 10, the governance plan. Over the last month or so, I've been working with David and several other folks to try to take what's in the statute and put it into a draft governance plan so that everyone is clear about how we make decisions and how we're selected. This has not been sent to you before, and so, but I want to walk through it since we have some time. Stacy, did you have a copy? They just handed out copies just a little bit ago. I can get you another. I'm good. Okay, I printed out 50 a little before I came in. But this is draft, but want to get some feedback from folks related to how far off I am related to what a fair governance strategy would be for this group. So again, a lot of this is taken from the legislation itself. And so page 2 goes through the background, Senate Bill 11, 86 legislative session, and the goals. We put down a vision for the consortium that all Texas children and adolescents will have the best mental health outcomes possible, given available resources. Then our mission is to advance healthcare quality and access for all Texas children and adolescents through interinstitutional collaboration, leveraging the expertise of the state health-related institutions of higher education, local and state government agencies, and local and state mental health organizations. And that the purpose of this document describes the governance, who the members are, and the organizational structure. And so I think that's pretty clear. And maybe it could be wordsmithed a little bit better, and we can talk about how do we do that if you have edits. But that's kind of the basic of who we are and what we're trying to do. Joseph, Dr. Blader.
David, can you just mention who's the author of this? Who's proposing this draft?
I and a couple other folks put this together as a draft, as a proposal, understanding that we have a very short timeline to get done what we need to get done. And if we could feel comfortable with the overall governance pretty quickly, it'll allow us to move forward on things. But yeah, I was very involved in putting this together and had legal counsel to make sure that I was on the right page. Okay?
David, do we need to vote on that one before any other operation?
Why don't let me kind of walk you through it, since this is the first time that I put it out here, and get a measure of how far off I am. If you think that I wouldn't, nothing that I've ever done is perfect, but if it's really close, maybe we can do a couple of edits. If it's way off, then I'll get your feedback, and we'll go back and at the next meeting have a draft that you would feel comfortable with approving. Stacy, does that sounds reasonable? Okay. So Mr. Wyatt went through the background of the consortium earlier. A lot of these components on the next page we use the same reference, and so it should be identical about who the consortium is, the 13 state-funded health institutions that are listed, HHSC, Higher Education Coordinating Board, 3 not-for-profits. Again, that's comes straight from statute. The duties of the consortium, again, from statute, that we will implement projects and research directed and funded by the Texas legislature. Texas legislature directed the consortium to implement the following programs using funds that are appropriated through the Higher Education Coordinating Board and reference. And then I go through the buckets of the CPAN, the Child Psychiatric Assistance Network, the Texas Child Health Access through Telemedicine component, the Community Psychiatric Workforce Expansion component, and the Child and Adolescent Psychiatry Fellowships. And again, those are the buckets that are in the rider or from the legislation. And then I put down, in implementing the CPAN and TCHAT programs, the consortium will leverage the resources of a hospital system in the state if the hospital system, and then have the components there of providing consultative services and training opportunities for pediatricians and primary care, and has an existing telemedicine and health program for identifying the components. Again, we took care of administering, figure out who those individuals were, but this again comes out of statute. The executive committee, and we went through that earlier today, related to who the executive committee is. Again, it's the same information that you got provided earlier. To put down some of the duties of the executive committee. The executive committee will provide leadership, decision-making, and identify the projects to be conducted by the consortium. I see I had a little typo there. It will be conducted by the consortium. I'll get rid of or supported. General duties of the executive committee, and I put down 10 duties. To provide counsel and insight on the best practices to improve mental health services to children and adolescents in Texas, serve as the appropriate work groups as noted below, coordinate the provisions of funding to the health-related institutions of higher education that form the consortium, establish procedures and policies for the administration of funds for the consortium, monitor funding and agreements to ensure recipients of funding comply with the terms and the conditions of the funding and agreement, establish metrics to monitor the impact of the consortium's initiatives, establish and revise the governance plan at least every 2 years, establish and revise our consortium strategic plan every 2 years, and approve specific projects and meet at least quarterly, and put a clause in there that all committee members are expected to attend at least 75% of the executive committee meetings. So I know I'm reading a lot, but I know there's people that are on the internet that are watching that don't have this, since we're just putting it out right now. But this would be the duties of the consortium, what our work job description is. Let me move forward with the rest of the document. Selection of the executive committee members. I went through, again, looking at the statute with the legal counsel for the nonprofit consortium members, the hospital system executive committee, and additional members. For the nonprofit consortium members, put down at the inception of the consortium and 3 months prior to the end of each term, as defined below, 3 nonprofit organizations that focus on mental health care will be selected by majority vote of the 13 state-funded health-related institutions of higher education to serve on the consortium. Organizations will be identified directly by the executive committee or through an application process. Again, I think as we move forward, having a more formal application process will be helpful. And put down that the term of service would be 4 years, but renewable upon reappointment by the majority of votes. The hospital system executive committee member, same type of language at the inception of the consortium and 3 months prior to the end of each term. The executive committee members will identify a hospital system to nominate to serve as a representative. The organization will be identified by the executive committee and through a formal application process. Then we'll review, the consortium will review the candidate organizations and through a majority vote of the 13 health-related institutions, select a hospital system to serve on the executive committee. And a little bit of background here. We had to be, as we were looking at the statute of who really has authority to name different components, some of it comes back to the 13 institutions versus the full executive committee. And so tried to make sure that that was incorporated appropriately in the language. Additional consortium and executive committee members, again, the clause that allows us to add individuals. Executive committee members can nominate an additional organization that is necessary for the operations and decision-making of the consortium. Any nominated organizations will be reviewed by the executive committee and named through a majority vote. All terms are for 4 years, but are renewable by the majority vote of the executive committee. The executive committee can also name additional executive committee members who are not representatives of the consortium, and these members will be named through a majority vote to serve 4-year terms, which can be renewed. Consortium member representatives, again, this is language that I think was shared earlier today, that each organization will identify the representative to serve. But I also put in a clause, just kind of termination of an executive committee member. The term of an executive member or workgroup member may be terminated due to one of the following 4 scenarios: a change in the role within the organization or employer, making them no longer qualified, such as any of you move to Maryland, it'd be hard for you to continue to be on this consortium. For nonprofit organizations or hospital systems, completion of the term and the organization is not selected for an additional term. Their organization agency selects a new representative. If your president of university says, I want a different chair of psychiatry, obviously that would change the dynamics. And the representative of an organization or agency is unable to meet the roles, responsibility, and tasks required by the consortium, including meeting attendance. And put in here kind of a process, the presiding officer working with the administrative support entity would have the authority to recognize and act on those terminations. We put in a paragraph about the presiding officer. The executive committee shall select a presiding officer from among the membership of the executive committee. The term shall be for 2 years, but is renewable upon the approval of the executive committee. And the duties of the presiding officer, we put down 5: serve as official spokesperson for the consortium, convenes and manages all consortium meetings, and oversees all workgroup meetings, solicits input from the executive committee members to provide opportunities for their ideas and concerns to be expressed, request input from stakeholders and partners, and serves as the intermediary between the executive committee and the administrative support entity to ensure the business of the consortium progresses between meetings. We put a little note that the presiding officer could be employed by the administrative support entity. And then also put in a clause that you, the executive committee, if the presiding officer is not doing what needs to be done, that there's a way for you to remove the presiding officer. And so if there's 2/3 of you that say David Lakey no longer needs to be the presiding officer, you have a way to bring that up and remove the presiding officer. Conflicts of interest: each executive committee and work group member will yearly document and disclose any real or potential conflicts of interest. a little bit of background here. We're looking and trying to figure out the best way to do that. We've looked at other models in the state of Texas. Some of them aren't necessarily appropriate for this group, and so it'll be more of a mitigation of conflict of interest and making sure that it's documented, because the inherent way that we're put together, your institutions will be doing this work. It's hard to totally eliminate conflict of interest, but we're going to need to make sure that we fully disclose those conflicts of interest. Executive committee voting and decision-making. The executive committee will make every effort to achieve consensus before voting. And I put this in, our history over the last 4 years of many of us working together. I can't remember a contentious vote. We have always kind of come to consensus and said this is how we support each other and making sure that all of our institutions their needs are met and recognize what institutions can do and what they can't do. And so my goal as a presiding officer is to continue that history and that we work together collaboratively and not have, 51-49 votes. If anything gets in that kind of realm, then I haven't done the job right to figure out what the right answer is. And so we will work for consensus, but things do have to be formally voted out before they're finalized. And so 2/3 of the total number of executive committee members shall constitute a quorum at the executive committee meeting. Voting decisions made by the executive committee will be by simple majority of the members present at any meeting, with the exception of votes to adopting and modifying the governance plan and the strategic plan and removing the presiding officer. The governance plan and strategic plan may only be adopted and modified by vote of 2/3 of all the members. And so, just make sure everyone is in part of that decision. Timing of election.
David?
Yes.
Question here.
Yes.
We were discussing 2 representatives versus 1 representative from an institution. There was a specific request. So are those 2 representatives considered a single vote executive committee within this comment? And is the rule of 75% of the meeting being present is for both representatives? That's what I'm trying to understand.
Yeah, very good question. And the way that it's written right now is that every member of the executive committee would have a vote. There's pros and cons to either way that we do it. This is a draft and a starting point. And if the executive committee wants to change that, we can change that. But right now, it's put in as every executive committee would have a vote. The advantage of that relates to quorum, related to that if there are you don't meet quorum, if you want to discuss adult mental health issues, we have to be careful that we don't have a quorum in those type of discussions. Obviously, we can't talk about in anything outside here related outside the child mental health, but if there are other things that aren't per se this group, but we have a quorum, it becomes a little bit problematic. On the other hand, it's a challenge sometimes for your institution to have 2 people here.
Right.
And making the quorum for this group. And so there's pluses and minuses to either way. I put this down as the starting point for that discussion.
Okay. So when we would like to, at least I would like at some point to move to this discussion when the time is ready.
Okay. Let me go through the rest of it, and then let's discuss it as a whole, if that's all right. We put that you abstain. Timing of elections, again, just trying to be formal. The election is selecting a presiding officer, administrative support entity. The rest of those entities would occur during a August meeting in odd number years, kind of like we're doing right now. And I think there's advantages of that because we come out of the session, you have the new direction from the legislature, and we're going to need to be able to, over the 2 years, put our plan together and then work through the session, and then after the session would be a good time for any changes. Put in the governance that we are governed by the Texas Open Meeting Act and also the Texas Public Information Act, as we discussed earlier. Put in a paragraph related to the administrative support entity. Noted that it would be selected by the majority vote by the institutions of higher education to serve as the administrative support entity for the consortium. The entity will enter into a memorandum of understanding with the Higher Education Coordinating Board to receive the funds allocated by the Texas legislature to administer the consortium. Administrative support entity will identify an administrative liaison and request that they be named to serve as a member of the executive committee. The administrative liaison may serve as a presiding officer. That kind of be where I am right now. Although subject to funding from the legislature, the administrative support entity would serve for 4 terms, or serve for a term of 4 years, and we can, Stacy, talk about if that's okay, but yeah, I want to have some continuity with the understanding the funding changes, that changes things. And that you're eligible for renewal, but must be approved by the executive committee. Again, so every 4 years, you can decide whether, right now, if the UT system is doing it the way that it needs to be done, or if it needs to be changed. Work groups, and this is an important part because we have a lot of work to do in a short amount of time, and we're going to need to divide up into work groups in order to do that. And that'll be the next part of our conversation. But the executive committee of the consortium can establish specific work groups through majority vote to develop draft proposals, plans, processes, reports, evaluations, and to conduct reviews on behalf of the executive committee. Work group leaders will be selected from and by the executive committee and will present their progress at the executive committee meetings. Work groups will consist of both members and non-members. I think this is important because there are folks that are not around this table, such as in the pediatricians of the state of Texas, or folks that are in education that I think are going to be essential as we try to figure out these plans for them. And so it'll be folks that are part of us and non-members of the executive committee who have the expertise we need. Members of a work group can be selected by the presiding officer and the work group chair between meetings if needed, but must be confirmed at the next executive committee meeting. I put that in so that we don't get bogged down and can't move forward, but still have oversight. And so we can form the work groups, but have them come and be the members approved by this group at the next meeting. All work developed by the work group must be presented to the executive committee and approved prior to finalization or implementation. Each work group will be discontinued after 2 years unless reauthorized. And actually, I missed something that I should have touched on earlier. Our reading is that the work groups are not subject to the Open Meetings Act. And so you can have frank conversations there, but they can't make final decisions. And so whatever plan that you put together in a work group has to come to this group in an open meeting before it is finalized and approved. Okay? We, by statute, need to select some individuals for other statewide committees, and so I go through that, which is, again, straight from statute. And then there's 2 reports that, by statute, that we will need to do. One is a strategic plan, and one is a biennial report. And I'm not going to read all of this again to you, but it has the dates and some of the things that come from statute. So this is my first attempt in order to get this conversation going. I kind of need to know if I'm way off, mostly there, or if there's some tweaks that we have. Israel brought up one issue that I think there needs to be conversation about, but let me stop there and get some feedback. Wayne?
David, on bottom of page 3 under duties of the consortium, first sentence is the consortium will implement projects and research directed and funded by the Texas legislature.
Yep.
And then you go on to describe 4 programs, and I don't see the word research again. I don't see any mention of research.
Yeah.
So was that intentional, or is there still room for doing research as part of this?
So this is the little bit of the delicate situation that we're trying to navigate, again, with full transparency to the legislature. Because the bill was reworked, it changed. The initial Senate Bill 10 had more formal statute that said that you can do research. But as it got winded into Senate Bill 11, that authority language isn't there. However, there is the rider that talks about that we need to provide information to the legislature about how we are collaborating on research and facilitating that kind of research. And so there's a little bit of a disconnect there between the two. And Andy, I'll pull you in a second. I think if we can kind of focus on the four big pots as top priorities, but also make sure that there's evaluation and other things that are linked to those. We're also, anything that we get approved, and this will be an opportunity for the legislature to weigh in, anything has to be sent to the LBB, and the Legislative Budget Board can say yes or no related to, will say yes or no related to all the funds. But it's a little bit of a gray area because of the change of the verbiage. Andy?
Is this working? Okay. I appreciate that. I think, though, that we need to talk about that as a group, because I think there's been some individual discussions prior to the formation of the consortium around this, but Senate Bill 10 was very clear about the research component. That was always a piece, and part of the reason it was a piece is because the expertise of the folks in this room is not solely, and I would even argue not primarily, clinical care delivery. The expertise of our medical schools is really three things. It's training, research, and clinical care. And all three of those things were built in. All three of those things were deliberated by the consortium. And all of the discussions that we've had up until now had research. And it's not the same as evaluation. Evaluation is not research. While through the sausage-making process of the legislation, some of that language did not make it from Senate Bill 10 into Senate Bill 11, the writer did make it. And the writer specifically uses the word research. And so personally, I would not vote in favor of a governance frame that did not explicitly reference research as one of the things that needs to be deliberated by this group. And we absolutely have to use our judgment. We absolutely have to put the four priorities for children's care first. But if we do not leverage that component of the strength of this group, we should at least have a chance to decide that by this group, as opposed to a document that has been drafted and put in front of us. So I personally would, I don't know if this is the right time, we can sort these details out through some other pieces, but I think that we formally need to add recognition of the research capacity of these organizations to the governance piece, and it needs to be incorporated into the work group piece. And if we don't do that, we should at least, we should decide, the consortium should decide, that we're not going to honor that particular part of our expertise. We're only going to focus on the other two legs of what we do, which is training and clinical care delivery.
So if I can make a comment here, I agree with the central core and piece of the research in the agenda. I think what's critical is not so much for the governance, but as much for the strategic plan that we all have to develop. And so I think that clearly research have to be written in the strategic plan. And I think that first working group that have to be put together, it's a working group of building in strategic plan and working group separate for the incorporating research, and let this group develop and see how we can incorporate it in a way that is at the same time acceptable to the legislation and the language of the bill, and also, as you mentioned, our strengths, our expertise, and our understanding of what's good for the mental health in Texas.
So I would make the argument, Israel, that the research question is so important, and it involves, it should require input from everybody sitting around the table, because we all have different backgrounds and agendas and areas of expertise, that I wouldn't personally relegate the research question to a work group, but would really suggest that we all consider it as a whole group.
I'm not trying to relegate that. I'm thinking that that requires a lot of careful thinking. Work group can be large, and whatever work group does eventually come back here for the discussion and approval. But it's easier to do it in the work group session when discussion flows free to start with. That's all what I was thinking. But I'm happy to continue discussing it here.
Other comments?
So, having been very aware of the deliberations during the session, I would support the strategy of having a work group deliberate on this issue, discuss this issue, and then come back to this group with recommendations on that component.
Okay. Octavia?
I agree. I think the research is really important and can be actually leveraged the four key components. What I want to know is, just throwing out, does the research need to be within the four buckets specifically?
These are the 4 buckets that are directly from the legislation. I did put the word research there. Yeah, there is the word research there in that title. There is the word research in the rider related to the strategy, but it is not in Senate Bill 11. Okay, and so we could add, if the express duties that come from the statute are these, you have the word research there. We could put a work group together and talk about it. Again, the feedback that I'm getting from university presidents is to make sure that the 4 primary buckets are done really well as the first priority. But if there are opportunities to do something that's collaborative, developing, et cetera, and the LBB approved it, we need to figure out how do we work through that.
So wouldn't it be possible then for the work group to come back with a recommendation to that very question?
It would be possible for us to set up a work group and have them think through that.
Yes.
And then come to a recommendation, but still pass a governance or modify the governance. Again, I need to get some basic governance going, understand that this can be modified in order for us to make sure we make formal decisions in a transparent way.
Yeah, I don't see any language in here that would prohibit reasonable research. Obviously, we're not doing randomized clinical controlled trials as part of this, but it seems the language is broad enough as is that when the work group comes back, let's do project A, C, and A, B, and C, we would be able to do so.
Carol, and then Karen?
So sorry to speak up again, but, I do recognize that there are a lot of university professors that want to make sure that the 4 buckets, the ones that you have specified, are are sufficiently resourced so that they can be done well, and that they don't need they won't stop halfway through. But personally, I think that I'm just used to doing this way, discussing as a group from the old chairs of psychiatry meeting, but there's so many perspectives around the table that are really important. There's the community mental health perspective, there's a state perspective, there's the legal perspectives, there are the voluntary perspectives, that I think that we need all those perspectives to weigh in on this question because it's so important. I'm not really talking, the specifics of the research can be discussed by a work group and fed back, but I really mean that the underlying question, I think, for me, because I'll have to go back to my president and talk about that, and it would be useful to have a full committee discussion.
Karen, Dr. Wagner?
Just with regard to work group membership, I'd recommend that we include our heads of child psychiatry, if they're not a member of this executive committee, from our academic institutions to be possible work group members.
Okay, I think that's valid. Andy?
David, I appreciate the feedback that you all had from the University of Texas affiliated presidents. I think that's important to consider, and they all have representatives here. But I think we have a broader representation in this group, and I think that we all need to seriously consider from the start how to make the clearest case possible to represent the intent of what this legislation was. And I appreciate that the word research is in the first sentence of the duties, but I think there needs to be some reference to it in the next sentence. And I guess I would like to move, subject to, of course, needing a second and needing discussion and perhaps even modifying it, that where it says to implement the following programs, we just add the term and associated relevant research, something like that. Because the word research is in the rider, you're referencing the rider here, and I think that just allows us from the beginning to have it enshrined in there, and then we, of course, will highlight these programs. I totally trust this group, but I certainly know that Danette and Sonia will not let us do anything to undermine the particular clinical community impact of this, as well as our hospital representatives. So I guess I trust this group to do that, to make sure that we adequately fund and put in place the 4 priorities that are in there, but we want to represent in the language of this, I would like us to represent in this governance piece that. So I guess I'm formally moving, we add the term and associated research after the term programs in the second sentence of the duties of the consortium.
And associated relevant research or associated research? You have two different versions there.
I could support, I don't want to get out of line in terms of the proper way to handle a motion that's emerging, right? But I could support adding relevant research. And
Yeah, relevant's fine, and relevant research.
Yeah, I would second that too. I don't want to see us get tangled up in wordsmithing a document that is flexible enough that we can drive the agenda later. I agree with Israel's original interpretation that the strategic plan is where this likely will play out, but I think a minor amendment like Andy's suggesting is a reasonable reminder. Recognizing that that's not what the legislators were actually thinking when they finally wrote this bill, and so we're going to have to work the funding side over time. But I think a minor amendment is a good suggestion.
I support that idea as well, and I think, at least from my standpoint, and I think I'm hearing from others, that whatever research we would conduct would be in the service of fostering those 4 major programs. And it might go a little bit beyond just doing outcomes, looking at metrics. It might be, actually looking at maybe some modifications. I'm not making a recommendation now for what we exactly do, but I could imagine there could be some evaluation in a prospective fashion of the programs, not just looking at how they do after they're implemented.
Mm-hmm.
I'm fully in support of your proposal, Andy. I'm not my question was not to get into the details of that. So as long as it goes, and because I think that's where the working group, I'm very happy to vote for that one too.
Octavio?
I'm very supportive of that additional language that Andy's brought up and others have pointed out. However, as Andy did point out, research is not evaluation, and we did talk about prior to this the importance of evaluation, so we can use that data and really give it back to our policy stakeholders, but also to our Texas community members of how effective we have been when we look at these 4 buckets. So at a very high level, I would add research and appropriate evaluation to make sure that we're being flexible, as Steve pointed out, and encompassing all the things we really would like to do in reference to our charge here.
Okay. Andy?
Yeah, I would just add too that for those, not everybody got to suffer through or enjoy, I should say, the legislative process and testimony on that. And David, you and I were at the House committee when Public Health reviewed this, and I remember very vividly Representative Frank having very significant concerns about the evaluation and also about, and I'm not trying to put words in his mouth, I'm just trying to say how I felt. Like, specifically the question was asked to me about what are the outcomes of this going to be and can we document them? And that discussion went on at some point. And I think there's legitimate concern on the part of stakeholders that we don't have the perfect solutions in every situation right now. We have some very good resources to put out there, but we have not yet figured out what to do after the first 2 years of early psychosis research as a field. We have a lot of things that we're going to need to figure out as a group. And I just want to specifically have it in the record of this, that my understanding from the office of the author of this bill is that research is allowed and that they see the proposal the consortium is required to submit to LBB for approval as the mechanism for the legislature and the officials to officially sign off on research. So I want it very clearly in the record that that is my understanding, and I want to make sure you all understand that too, based on our involvement in that that's what we believe. And I think other people are free to follow up with that office if they would like to figure that out themselves and to see. But that's something that I think this solution will address that, and then the work groups I think can help envision that as we go forward. Okay.
I also think it's really important. I agree and support the addition of that language because when we get into the work groups, it helps. We are going to have access to a lot of data if we design appropriately and in a way that we can mine and move the field forward. We're mandated to look at that from the beginning within these buckets. I think that's very, very important.
We've gone, and we're all saying the same thing. Can we move the question?
Yeah. So what I hear, again, we're not changing the buckets. They're all related to the buckets, but the first line would be changed to TCHCC will implement projects and research directed and funded by the Texas legislature. The Texas legislature directed the consortium to implement the following programs and relevant research and supportive evaluation using funds that are appropriated by the Higher Education Coordinating Board, and then the rest of the sentence. That is the motion, Andy, that I hear that you have made. Is there a second related to that? Alan, all in favor of that change? So be it. Okay? All right. Any other modifications? Sonia?
Okay, so on page 5, when we start talking about the duties of the executive committee, number 1 talks about provide counsel and insight on best practices, so forth and so on. One of the things that I want to make sure is that many of you know that we also have a statewide behavioral health coordinating council. 23 agencies, state agencies are represented there. A lot of work has been done already in terms of identifying, what some of the gaps are and what some of our approaches are. I want to be sure that we're not duplicative in that regard in terms of their focus, versus the focus of this group. I know that later on the tail end of this document, it speaks to even having representation from this group on the statewide behavioral health coordinating council. But one of the things, when I looked at that very first sentence, it seems so very broad and maybe a little bit shying away from what the buckets are that we have been charged to do. So I wondered whether or not we need to look at some wordsmithing there as well. Does that need to specifically talk about, how that may be focused on state university systems, or something to that effect that narrows that focus. Otherwise, we can either undo or be duplicative of some other work that's going on.
And our goal here was not to replace the great work that you're doing, but to provide counsel to you and others, part of the duties as the academic centers figure out how do we move children's health forward. And so we have later on that there is a representative here that's part of your group that would be providing that counsel. But if there's some specific language to change that, I'm happy to have the group consider it.
So the only thing I'm saying is that we've gotten a clear charge about the buckets that we're to focus on, and it seems like that focus is targeted at state university systems. So I just wondered if you can leave the language, but just insert improve mental health services in state mental health systems. It could be improve and or develop. And state university mental systems.
With the state of mental health care in the state, I think develop is a good word to use. I'd vote for that.
But we're not all members of the state university system.
Yeah,
who are sitting around here. So and
Andy?
Well, I would just add, too, that the intent is really for all children and adolescents in Texas. It's not just those funded. It's all children and adolescents.
So I don't have the legislation in front of me, but does the legislation speak to that? Does it have this language in it? I'm sorry, I don't have it in front of me.
Let me see if I can put, to address urgent mental health challenges and improve the mental health care system in the state in relation to children and adolescents, and enhance the state's ability to address mental health care needs of children and adolescents through collaboration of the health-related institutions of higher education.
So of the health-related institutions of higher education.
Through collaboration of the health-related institutions.
Okay.
But at the beginning, to number 1, address urgent mental health challenges and improve the mental health care system in the state in relation to child and adolescents. And then it says, and 2, enhance the state's ability to address mental health care needs of children and adolescents through collaboration of the health-related institutions. Andy?
Dave, if I could just add, I think, Sonia, to me, I'm not entirely sure, I don't want to say I fully understand what goal to meet here, but one way I think to maybe meet some of this is there's language, the bill specifically references the strategic behavioral health plan. And I think by implication, and I think by the appointment of you and Mike on the board, there's the expectation that we will coordinate with the Behavioral Health Coordinating Council. And I wonder if we should just add an explicit coordination language with the statewide Behavioral Health Coordinating Council to say that our recommendations, that we won't make recommendations in an isolation. We will make recommendations in collaboration with that. I mean, I don't know if that gets at the concern, but to me, that's absolutely, that's in the
I think that would help,
statute.
because we have similar language in terms of focus in regard to the work we're doing on the coordinating council. As I mentioned, we already have a strategic plan in place in terms of many initiatives that are already going forward. I certainly would not want this group, and not everyone in this group is familiar with that work, to believe that, you know, all of that can be undone, or it's, you know, as if it doesn't exist. So I think, you know, some wording that acknowledges or, you know, kind of talks about the coordination, I think would be very valuable.
So Sonia, kind of what I heard, if I was to put it down, maybe start off with, in collaboration with the State Behavioral Health Coordinating Council, provide counsel and insight on best practices to improve and develop mental health services to children and adolescents in Texas. I was going to put it at the end, but I thought it'd be more obvious if I started at the beginning. That's right.
Just make sure we use the proper title. It's the Statewide Behavioral Health Coordinating Council.
Statewide Behavioral Health Coordinating Council. Okay. We have a motion here. Do we have a second? Okay. In collaboration with the Statewide Behavioral Health Coordinating Council, provide counsel and insight on best practices to improve and develop mental health services to children and adolescents in Texas. That is Dr. Steve's motion. Do I have a second? Got a second from Carol. Any further discussion? Seeing none, all favor in that change, signify by raising aye. Noes? Abstains? All right. Changed. Any other changes to these?
I want to channel my friend from College Station suggestion that I think is a good one, that the two representatives from each of the HRIs, is that right? HRIs, are treated as a unit. And so we are one vote, we are one count towards quorum, we don't double the thing, and our attendance is combined, because I think that was what we all, at least at our place, that's kind of what we were thinking it would mean.
Okay.
And that increases the likelihood that at least one of us is always here representing our institution. I also think we're going to vote in blocks of two anyway, and so it's duplicative. So that would be my suggestion, but I'm more than happy to be told that's incorrect.
Carol?
But what if the two disagree?
Yeah, I think that kind of stuff, in my opinion, belongs back at your home institution in a conversation.
Okay,
But that's just my opinion.
I think there somewhere in the text, some matters that would require a majority of the HRIs, which presumably each HRI would cast one vote. Could you say, do I have that? Well, but there are some things that, at least in David's draft, that there are some matters that would apply, and others there would be a majority of the committee that would apply. Maybe, could you explicate a little bit on?
So what I think you're talking about is again, as we're looking through the language, is the hospital representative selected, the not-for-profit entity selected, that's a vote of the institutions of higher education. Yeah. And there's also language in there that the overall strategic plan and the governance plan, that the quorum is set by, not by the number of people here at the meeting, but by everyone that is part of the council. Peter?
I can just tell you, Dr. Stokowski, my president would not be supportive of that, and he was clear that he would like to have each of the different members have an independent vote.
Okay.
Yeah, there's also the practical problem. If we do it, if we're combined, then whenever the chairs of psychiatry meet, then don't we come automatically
Then it helps us not become a quorum.
Yeah.
And again, we wouldn't talk about child mental health services, but it would give you the ability to talk about adult services. Carol?
So there are units here that are, in addition to just the units from the higher education schools. I mean, like there's HHS has 2 members here. So I think if we're going to talk about units, we need to unitize all of us, or otherwise we all need to be independent voters.
I want to give Dr. Williams the freedom to exercise her own vote and opinion.
Yeah. So I guess what I might suggest is that you leave it, Israel, the way it is, but understanding that this can change, that you know, if a half a year we figure that this is not working, we could change the bylaws and the governance plan. But there are institutions, and Peter just noted one, that very much want to make sure that both individuals are able to vote.
Okay, let's try to modify that a little bit to try to address both needs. Let's talk about the fact that institutions will have 2 votes, but if a single representative is present, he can vote both votes. And also the forum, if the single representative institution is present, that's a single representative that constitutes quorum.
David, could you pull in?
One thing we can do is authorize voting by proxy. If you're a member of the executive committee and you have an independent vote, you have to exercise that vote yourself. Somebody can't do it for you.
My other worry, why I propose this, but if it's not allowed, I'm completely fine. But if each of us has 2 members, that's 26 people, and then we add the other people, quorum gets to be a bigger and bigger number that has to be here to meet. And if half the people who are the pairs don't show up, we're not going to make quorum. And as a member of other open records meeting groups, that ends the conversation, and you can't actually do any business.
That's what my concern as well.
Today, I don't even know if we meet quorum today, but as it stretches out, I'm concerned that when half the HRIs show up, we're never going to make quorum. So that's my other concern.
Daniel Delay?
Yeah, no, so I'd echo what Dr. Thompson said. The other thing I would mention is the legislature went through great lengths to make sure that there were 2 designees from the HRIs separately listed in statute, and to combine those 2 would seem to contravene the legislature's intent of who
I don't think that was legislation. I'm sorry to interrupt. I think that was a specific request from the...
No, actually, the statute says a designee of the chair of the HRIs and a designee from the president of the HRIs separately listed.
You mean here or in the...
statute itself?
Yeah.
So that was different than it was discussed earlier.
I don't know if it's different than discussed earlier. It's been, the statute says that each chair of psychiatry is here, plus another, that every president can place an additional individual here as part of this consortium, and every institution did.
So a logistics question as well, just for my understanding. So there's no proxy voting with the open meetings. Is there the ability, because in the chairs meetings previously, sometimes we would call in and have discussion. Is that allowed, or everyone has to be physically present?
You can't do it by teleconference. Under certain circumstances, it's possible to do by video conference, but we're going to have to work on whether that's even logistically, much less legally possible. You cannot call into a meeting and participate.
So I'll just chime in as well. One thing in terms of trying to get a quorum for this particular meeting, I did face a challenge, and I took the narrowest view of what that could be, and I thought only the chairs. So I know that there are at least 8 of you here today. So my concern is if you want to do the quorum, you might want to rethink the numbers, like half plus 1 might work.
That was my point.
Yeah.
See us heading the meeting without quorum.
Certainly with a group this big, we run into those challenges here at the coordinating board. The other very technical bolty nut and bolt thing is there is a provision in the statute for vacancies, and I would just suggest that that language be added.
Okay.
That's really not very exciting, but
I move towards
relevant.
half plus one and just put this the rest.
Okay. Are you okay with half plus one?
Yes.
Okay.
So-
Equally? Okay.
So we have discussed last time, and, half plus one is good, but we have discussed last time that whether we will vote as institutions or vote as individuals. Am I understanding from the legal point of view that discussion was moot?
I'm not sure so there was a general discussion at the last chair of psychiatry meeting, and again, that was just the chairs of psychiatry, not the other individuals that are part of this executive committee. There was thought related to voting by institution. We made sure that there wasn't an official vote because
we didn't vote.
because we were not a consortium and could not make any decisions. Again, the difference between that meeting and this meeting is that this is now the formal Texas Child Mental Health Consortium. There's other individuals that are here that are part of this, and they have to be in agreement. And again, there's several people that have voiced, as they're talking to their institutional leads, that they want to make sure that both individuals have that vote. And what I heard is a compromise, because of the issues of quorum, is to change the quorum down to 50% plus one so that the meeting can move forward, but that if two individuals from UT Tyler are here, they can make sure that they're both able to vote, and there's a reason that they both come to the meeting.
David,
Yes.
if I may ask, is there still the consideration of, later on the agenda, there's a question about future meetings and location. Would that give any relevance to the discussion and conversation around quorum, or is there already an assumption presiding about bi-monthly, et cetera, in terms of the number of meetings?
So we're jumping ahead a little bit, but I think it's very relevant. You know, we got a lot of work to do before November 30th, and I can't see how we're going to get that done if we're meeting every 2 months over this next time period. I think this group is going to have to come together in a month, again, after having the governance, having work groups set up, have some preliminary discussion on what the work groups are finding, and start moving very quickly to developing that strategic plan if we want to get it done. I think once we get out of, so again, timeline here, we got to get this in by the end of November. Would probably get approval, if it's not disapproved, it's approved by the end of this year. I think there'll be some other meetings then to get things going, but then we'll get a different kind of battle rhythm because at that time it's more monitoring and learning versus the work that we got to do very quickly in developing this plan and allocations per bucket, allocations from institutions. That's a lot of work that has to take place very quickly. So that was a little bit of a roundabout conversation, but I think, again, part of that location, it's going to be here in Austin. I think it's the only way practically that we can get this done. Elizabeth?
So I started this, I would like to stop it. I agree. I think the quorum was my big worry because I just know academics and I'm very worried about the number. And so I think I want to second the previous motion that Dr. Vo made and would like to see if we can call the question.
Second, I want to let Elizabeth talk and then we'll go. Dr. Newland?
Can the chair send a proxy at any point, or is it only they're allowed to designate a proxy at the beginning of the committee?
The designations and appointments for the executive committee have been made unless changed, but in the same process in which they were made in the first place. So there's no process by which you can appoint a proxy and have that person act for you at the meeting. You are the executive committee members. That's right, unless removed and replaced by that same process. That's right.
And I guess the nuance, David, if I may here, is that we'd want your institutions to be involved in the conversation, but they wouldn't be able to vote, right? The quorum has to do with voting. And so the discussion, being your eyes and ears here, I'm going to welcome them to sit around the table, but I can't let them vote and be part of the determination of a quorum. Is that fair, David?
Yes.
Okay. And again, my goal is that we work collaboratively and make these discussions, these decisions by consensus as much as possible so that we are getting 95, 100% votes on the things that we're trying to do. Octavio? And then this is the final question, and then I think Danette is going to be able to, Ms. Castle, and then I'm going to limit it, and we're going to have a vote on this.
Okay, good, because my question is just clarification. What is going to be quorum? What did we all agree to? And two, do we have quorum now to continue to actually continue our business?
Okay, what has been put on the table for this governance is quorum is half of the members plus one. Okay?
And
that is the motion that Dr.
Each member has
Sokowski
one
seconded.
vote.
What's that?
It's clear, clarifying.
With each executive committee member having one vote. Danette?
So do you have a motion on the table? You're waiting for a second to go on that?
There is a second. We're doing discussion.
All right,
You're the
so
last
no.
question of the discussion.
I've got another topic before
All
we
right.
close.
All right, so we're going to vote on the motion that quorum get changed to half the members plus one. All in favor signify by raising your hand. All opposed? Abstained? You have unanimous approval. The quorum is now 50% plus one. Ms. Castle.
All right, so I'm going to take you to a different place.
Okay.
Page 2.
Page 2.
Vision. I'd like the thinking on, so I'm very pragmatic, and I tend not to be really blue sky, but I would like to suggest the possibility of taking out the language "given available resources."
Okay.
So that our vision is really about all Texas children and adolescents will have the best mental health outcomes possible. Period.
I'll second that.
We have a second. All in favor of that change? Unanimous? All opposed? What's? Oh, was there any discussion? No, okay, let me Robert Rules of Order, I needed to have discussion. Carol?
So I'm totally intimidated by making sure that all Texas children and adolescents have the best mental health outcomes possible. I mean, it's real.
Yeah,
Well, then,
it's a
if we can
vision.
indicate somehow that it's aspirational, if all of us psychiatrists have the obligation to make sure this is true, that's really scary. If it's aspirational, it's okay.
That's why it's a vision statement. You envision towards something.
You can achieve a vision.
Okay. So I think and Carol, kind of to your point, that there is language in the bill that says that our institutions are obligated only to the amount of that the resources are available to do this work. I think the vision, what are we trying to aspirate to?
And that's the same statutory construct for our members as well, for Community Mental Health Center. So the statutory construct relates to given available resources. So I'm not intimidated by the inspiration of the vision statement.
Okay. Dr. Wakefield?
I also, I'm happy with the vision statement as is, but I would offer that it might make it feel more achievable if we said work towards, that we work together towards a Texas that has the rest of the sentence or something like that, if that's more palatable. But I'm also happy, I understand it's a vision statement.
Andy?
I mean, I get that, but let me just say, the reason that this happened was because we had some really bad things happen in the state that drew people's attention to the mental health of children, and they were really, I think, inspired by what this group does. So if we, in our vision, cannot be unequivocal, then I'm not really sure we're following through on what we were charged to do. So I think there are plenty of other opportunities, specifically our actual recommendations and budget, where we can, be frugal or be careful. But I think in our vision, it's aspirational. And I think, I would argue against anything other than the amendment that Danette made.
Okay. So let me go back. Do we have a motion related? We already, but we kind of went back, yeah. Yeah, see, I got to go back because we did discussion. And so I have a motion from Ms. Castle to change the vision statement to all Texas children and adolescents will have the best mental health outcomes possible. I have a second from Dr. Vu. All in favor signify by raising your hand. We have a unanimous vote that the vision statement gets changed. Okay? Other questions? Alan?
No, I'd like to make another motion that
Okay.
at this point we move forward with our plan. And if we have, because I believe there are other things we need to do this afternoon, we can always come back and edit what our governance plan is. I would like to approve our governance plan.
So you have a motion to approve the governance plan?
Yes.
Okay?
As amended.
As amendment that we've done today. Yeah.
Can I ask one clarification question? before
Okay.
we do that? On the, under the termination section, is there, I.
Which page?
On 6.
Okay. Termination of an executive committee member, yeah.
Is it laid out how someone would be reappointed or another person would be appointed in place of someone who's terminated?
So I think this gets back to Dr. Silverman's comments about vacancies. And so one of the amendments is that we need to take the language directly from the statute related to how vacancies are filled and put that into this document. And so that's one of the additional amendments that you'll be approving, okay? So I have a motion related to approval. I have a second from Dr. Chasse. Any further discussion? All in favor of approving the governance with the amendments that have been made and approved signify by raising your hand. Okay. All opposed?
No, that's too
I
late.
see no opposed. Anybody abstaining? This governance document has been approved with the changes that we made here. With that, Dr. Silverman, I think it is lunchtime.
And we have lunch directly behind us, so feel free to grab some lunch and come back to your place. And
Okay. Why don't we have like 30 minutes to eat? And so I will plan to reconvene us right at 12:30. Okay? Very good. Thank you. All right. Well, why don't we go ahead and reconvene and move on to item number 11 of the agenda. And as I noted at the beginning, we have a lot of work to do on a pretty short timeline. We need to have our plan ready to submit by the end of November. And we're not going to be able to do that in gatherings of this full group. We're going to need to have work groups that are meeting, which have some authority to put together some plans. Again, they don't have the ability to approve those plans. They have to come back to this full group in order to be approved, but need to do the preliminary work for each of these areas, determining things such as with the CPAN, kind of the areas that each institution will be providing services to, looking at the cost structures between institutions to make sure that we're meeting every institution's need, but they aren't very disparate as we do that. With the TCHAT, looking at the models that have been in Texas, how do we address those? What areas, again, what schools are the primary target that we can move forward to? The fellowships, what are the capacity for the different institutions to stand up fellowships? How many are reasonable to fund? Working with in the last one, next to the last one, looking at the local mental health authorities and modeling off of what's happened at UT Southwestern. Danette, looking at what local mental health authorities are interested in all of these. As I noted earlier with the work group membership, we put in that governance that we approved that we can add other individuals that aren't at this table. I think it's going to be very important as we think through and craft those groups. Who are the other people, who are the constituents that need to be part of that conversation? For an example, with CPAN, we may develop the best program to support pediatricians, but if they're not there, part of that decision-making process, we may develop a tool that they're not going to use. And so want to make sure that they're involved in the partnership with the schools. How do we get the best representation there? And it can go on and on. So, but a lot of work that needs to take place in the work groups and defining the work groups. So what I would like to get done today is basically defining that structure of work groups, some preliminary tasking of individuals to either chair it or being co-chair, being part of those work groups, thinking through who some additional partners could be, and then we will work to develop those groups out. But we'll need them to be able to move forward and come back at the next meeting and provide a preliminary report related to what each of these programs is going to look like, and get further input from this whole group. And so that's my plan for the next part of this meeting, is to figure out what that looks like. Does that make sense to everyone? So let's kind of going through the different parts. Part one, with the CPAN, the Child Psychiatric Assistant Network. Any questions related to what that looks like, or who is interested in that kind of work? Looks like several hands related to that. Chair, Laura, you've done a lot of work with the CPANs, with Baylor. I guess I'd like to pull you in to be part of that leadership team, at least as a co-chair of that group. Would that be amenable to you?
Yes, I'd be happy to do that.
Okay. Yes.
Dr. Martin's also.
Okay. Okay. Dr. Martin? Okay.
I'd like Dr. Blader to be on that work group for that.
Okay.
I raised my hand.
Oh, I didn't.
I'm volunteering Dr. Andy Harper from Texas A&M as a member of the working group for that.
Andy Harper?
David, can I clarify one thing?
Yes.
we're right now getting the executive committee members that are going to be these work groups. As you, I think, said earlier, we can have other members too on the work groups.
Yes.
Are we going to, will those people be appointed today, or will they just show up and be helpful?
So we put in the, so kind of a balance of what we put in this governance plan that the chair of the group and the presiding officer could add members to the work group, but then that slate of individuals for the work group would then need to come back to this group for final approval. And so we can add, I think if I can get the executive committee members of each of those work groups kind of delineated, who a couple of the other individuals could be, and then we'll work with the chairs to build that out and come back to the next meeting related to the full slate of members.
So if there's someone that we wanted to have on that work group to work with them between now and the next meeting, it would be important to mention that person today, so they would be able to have standing, or could they go to the meeting in an unofficial capacity?
They could go to the meeting, and then at the next meeting, we could vote on that slate of individuals.
But will we name any of the non-executive committee members today, or will we wait on all of them, or later? Will we name any of the non-executive? No, Andy Harper's on the executive committee.
Yeah, I think if we just get the executive committee members,
Okay, yeah, that makes sense.
if I get the executive committee members divvied up between these work groups and have a chair and have the ability to empower that chair to find the other individuals that they need to fill out the work group and have them move forward, I think that's a win for today.
Totally agree. I just want to clarify that.
Okay.
Thank you.
All right.
My division
People
head.
can remember to use their microphones. There we go.
Melissa DeFilippis will work with that from UTMB.
Okay. Can you help me with the spelling of the last name?
DeFilippis.
Okay. Okay.
I'm going to nominate myself.
Oh, wait, okay. Elizabeth?
Same with me, David.
Okay.
I'll nominate my proxy, Jim Baker.
Jim Baker. Okay. Okay. All right.
Can we clarify, is there an expectation that there's somebody from every health-related institution on each work group?
I don't think there has to be 13 individuals on each work group. I think you're going to need to get information back from every 13. They're going to need to tell you what the cost for their CPAN, et cetera. But if I put all of you on every work group, it's going to be a problem with the quorum and just getting things scheduled and getting done. I think that there needs to be a trust. What the work group needs to do is figure out what looks good, to have communication with every other institution, making sure that their voice is there. But I don't think we can have all 13 on every work group.
I would pitch the Strakowski rule of 7. You know this because you're in other meetings. Once the group's bigger than about 7, it's no longer a working group, it's an informational group. And so we're going to have to rely on each other's openness and trust, or these will become non-functional almost immediately. So I don't know if we want to formally cap the size of these work groups. I would suggest thinking about it.
Yeah. So I have 8 members now for this one. And again, there are some other organizations that represent, like the Pediatrician Voice, that I think we're going to need to add to it. And so I would cap it right now. And Laura, I'll ask you, Dr. Williams, to have you work through the other members, and we'll work with you on that. And within a week or so, if we could figure out who the rest of the group would be, have some conversations and have some initial, conversations. Again, this group here will need to meet in about a month, and we need to have at least the issues identified and the process outlined on how we're going to make the strategic plan for the CPAN. Okay? All right? Okay, I'm going to move on now to the T-Chat component. Dr. Vo would like to be involved. Dr. Wakefield, you guys have done a lot of work in this area too. Would like to make sure we don't lose that expertise.
Yes, definitely. We're happy to be involved.
Okay.
We've got a program going, so I'll work with Dr. Bell.
You're with Dr. Vo? Okay.
And she wants to be on it.
Yeah, I mean, Yeah, we have over 150 sites across North Texas, so children's health representation.
Okay. Who else would like to be part of that? Alan? Danette? Oh. Doctor? Okay. One of you, Dr. Matthews, or?
I can serve as the person on the faculty member that will want to.
Okay. You got, again, so again, I have a list of folks. I have right now, I have 1, 2, 3, 4, 5, 6, 7. I have 8 folks that want to be part of that.
You talking about TCHAT, David?
TCHAT.
Did we want to include like other parties, like maybe Nora Belcher?
I think this is the executive committee. I think there are folks like Nora Belcher. I think on TCHAT, I think we need to have a conversation with schools.
Yes.
The TEA and some other schools to make sure we don't design a program that's a bad fit for the schools. And so I probably need to cap that. And as Octavia, you want to be part of this one too. But
Yeah,
I think I'm going to need to cap it pretty quickly.
Well, so my question is, if you cap it, so after this meeting, if we were thinking about other relevant parties, do we
We can
not
still
bring
add
them
them.
to the attention of, say, you or the committee? the work group?
For this one, I'm going to task Dr. Wakefield to chair. And so if there are other folks, let her know. But again, I think as part of her charge, we'll figure out what are the other entities that we need to put on that. Andy?
David, just to formally clarify, we have not adopted caps. There was a suggestion that you not assign everybody to a group, but there's no official caps on these things as of now. So like, we're all free to work with the chairs, to develop.
We can put more folks. There's just,
Hey, David?
Yeah.
I have a suggestion.
it'd just be my advice, again, that we don't have all 13 institutions on all things and be able to get function out of this and move forward.
Hey, David, for this particular work group, I'd like to make a recommendation. I mean, nothing against Dr. Wakefield, but, I mean, I'd like to recommend that the chair and co-chair of this particular work group actually has programs in the school space. So that would be us and probably Children's in Dallas.
Tech has been running a widespread program called Twitter in the past out in West Texas for a number of years.
So we have 3 institutions that have, I mean, at least have another co-chair institution that has a little bit of a variety of experience in providing telepsychiatry or telemental health services into the schools.
Okay. I'm okay with a co-chair. Again, Dr. Wakefield, I'll work with you to make sure, but Alex working with her, I think that'd be great. Danette?
Leahy, I want to be sure that I'm following this properly. You're trying to get the names here of the executive committee members who will
Yep.
sit on these particular 4 areas, right?
That's right.
And then subsequent to that, we'll give consideration, subsequent to that, we'll give consideration to other people who it would be good to have also serving on that. So I'm expecting contact information and some opportunity then, or a mechanism for us to dialogue without creating quorum problems or whatever.
Yeah.
But because I think it would be good for me to be able to identify a person from a local mental health authority to at least 3 of these that I can identify who could at least be helpful in terms of conversations about what those interactions might be.
Yeah.
So I'm wanting to be sure I'm following. And
I think that would be fine. Again, I don't want all 13 institutions on every work group. We need to have the other people that have a different experience than us added. I'm not capping it. Advice, though, is be careful that the work groups don't become so large that they become non-functional. Okay? Okay. All right. I'm going to move on to this. This, I think, will get us started on this. For fellowship, Elizabeth, Dr. Newland, you guys have been very involved. Would like to have you in the middle of this, the fellowship development. Is that okay? Okay. Dr. Chassé?
Are we on 3 or 4 here?
We're on the fellowship development.
Number 4?
Yeah.
All right.
I guess I took it out of order. I wrote it down. So it's for the fellowships, again, to develop the adolescent psychiatry fellowships. What other institutions? Well, yeah, that'd be great.
Yeah, I'll volunteer on that one.
Okay. Anybody else? Anybody from Baylor or? Yeah, you'll have somebody else. Israel? Would you like to be part of the work group related to the fellowship development or in another area?
I was waiting to get to the research group,
Okay.
but and I don't want to take too many responsibilities.
Okay.
But
Okay, that's fine. That's fine. Anybody else related to the fellowship development? Okay.
Can I ask a question? This is just a suggestion and a question at the same time. Would it be appropriate for number 3 and number 4 to be the same work group? Because it's funding for 2 years.
Yeah. I think they're different.
Different tasks.
I think they're different tasks. So I think, again, I think the questions they're going to ask are going to be a little bit different related to the number of universities that can stand up fellowships and the cost of doing that versus the local mental health authorities and who wants to be part of that. And so I think they're different. Okay? But you're welcome to be on both and figure out how we do it. Local mental health authority in partnership with local mental health authority. Okay. Yes.
Is this limited to the local mental health authorities or to other mental health, community-based mental health providers, such as the federally funded healthcare centers that we have in El Paso?
I think it's broader. Let me pull out the bill. I think the language is broader. Mm-hmm. Okay. The community, it says, quotes, community mental health provider means an entity that provides mental health care services at a local level, including a local mental health authority. Okay, that's the bill. Okay. Okay. So Peter.
Dr. Harper from Texas A&M.
What's that?
Andy Harper from Texas A&M.
Okay.
He's already on the committee.
Mike Maples. Okay.
David, I'll do it.
Stephen. Jeffrey Matthews. Danette, I took it for granted that you have to be in the middle of that. Okay. Okay. What's that? Mark? And Michael? Okay. And Elizabeth, you want to be on that one too? Okay, so we have, that one, again, will have lots of folks, but that's good. Carol, did you want to be on this one or not?
I don't have to.
Okay. Okay.
I'd be willing to, if you want me. How big is it? I've been trying
Okay.
to see how big it is.
Okay. So is there a group of the folks that nominated that would be willing to take the leadership role on that one? Stephen? Okay.
Hey, David, will a list be generated with people's names and contact info, and all that?
Yeah, we'll generate the list. Again, then we'll work with the co-chairs to build out these lists. And then we'll need to bring that then to this full group at the next meeting, okay?
So, Dr. Lucky, is that the process you want us to go through if we have other folks to add?
Yeah,
that aren't-
go to the chair. Go to the chair of that working group, okay? All right. So for the local mental health authorities, Danette Castle, Sonia Gaines, Peter, Andy Harper, Mike Maples, Kenyo, Steve Plitzka will chair, Jeffrey Matthews, Mark Chesay, and Michael will be part of that, okay? All right. All right, and now it sounds like a lot of folks, we talked kind of another work group to figure out what this can look like related to research. And I think a lot of folks want to be a part of that. So Israel, you talked about being part of that. Okay. Who else?
David, I'd like to be part of that, and I'd also like to nominate Carol to be the chair of that work group.
I'll be a member.
No, you need to be chair.
Joseph? And Steve, were you nominating Joe, or did you? Yeah. Yeah, that's fine. Oh, it's Joe, okay. Okay, Michael?
Steve?
Are you going to nominate Charlie?
Charlie?
Sure.
What's that? Who's that? Steve? Is he part of the executive committee? Yes. Okay.
He's like Andy Harper, he can't decline.
All right.
Can I put Jair Suarez?
Yeah. Yeah. Okay. So I have Israel, Andy, Carol, Joe, Michael, Charlie Emroff, and Jair. Okay? All right. And we had a nomination of that group, Carol, for you to be chair. Okay. Again, we'll work with the group and try to figure out scheduling, et cetera. And again, for all these, trying to figure out by the next meeting what the big issues are, how do we try to address this, the strategy. Again, understanding with all of them, we got to have a strategic plan for doing it by the end of November.
Well, I would say that for the ones that relate to program expansion, we actually have deadlines that are quicker than that, because you have to go to the national body for the RRC to add programs and increase program size, and also for the match season that's coming up to get new fellows. That deadline to increase program size is coming before that November time. So we really have to, if we're going to try to expand programs this year, we have deadlines that are looming for that one.
Okay. So I would encourage the chairs then for those type of deadlines at our next meeting. And if you have a deadline that's aggressive, that we have that discussion here. And again, we'll figure out the costs. Again, we need to have some of the costs and the budget, et cetera. But again, that was one of the priorities for the legislature that we moved that forward. Okay. Any further discussion? All right. So let's then move to, I think, next to last item, discussion and possible consideration of conflict of interest for our work group. David, did you or? Okay. So, well, I'll jump in, and the folks that are lawyers around the table can jump in and correct me where I'm wrong. So we do need to have a disclosure of conflict of interest. We are looking at other models in state government here in the state of Texas. Some of them aren't really applicable. I think at the next meeting we will develop a form. I think we have to disclose and mitigate. It's going to be impossible to totally eliminate conflict of interest because your institutions will be the ones that are expanding the residency programs. Your institutions will be doing the CPANs, et cetera. But we still want to make sure that we disclose that and mitigate it. And I think it's easier in many ways if we're developing a plan that all of us are voting on and are putting it out there versus having a lot of individual grants like CIPRIT has, where it's easier for them, for their executive committee to exclude themselves from a vote on a specific grant For this, we'll develop a plan which will be going to all the institutions, and we'll just need to disclose and mitigate the conflict of interest. Any discussion, or David, anything that I said that was wrong there?
No, there's nothing you said that was wrong.
I think I said better. Yeah. You got folks from Higher Education Coordinating Board, you guys good with that?
Fine with it. I will say that we do have a few programs here at the coordinating board that funding does go to members directly that are on the advisory committees. They're direct institutions. So what comes to mind is the Family Practice Residency Advisory Committee. They have set a very rigid formula in place. So the constructing of a formula to sort of allocate money might be something you consider under some of the different work groups. That's just as a process in terms of grant management.
Okay.
But.
All right. Well, let me take one step back. You know, as I'm looking at the group, then kind of looking at everyone in the audience, not everyone on the executive committee is on one of the work groups. And so if there's a member of the executive committee that would like to be part of one of these work groups that we haven't listed so far, let us know. We'll figure out how to include you into that. Okay? Any other questions about the conflict of interest? All right. Hearing none. Last item, future meeting and location. Looking at Nagla on our, I think we've already sent out a previous chair of psychiatry date. Can you remind me of what that date is? Yeah, so we'll need to get something on the schedule for, what's that? Yeah, we'll send something out. I think we're going to have to meet within a month and to move this work forward on our timeline. Again, in the interim, the work groups will need to schedule a phone conversation, fill out your list of people, get a phone conversation, and plan at the next meeting to have a preliminary report out from each of the work groups about the progress being made to get the strategic plan done. Okay, and that will be an opportunity again for the other institutions to be able to comment. Joseph?
I have an other business type of question, and it's probably more reflective of my ignorance than anything else, but what is either statutorily or with respect to this particular project, the upper age limit of a child? What age group are we devoting our attention to? Up to 18, up to 21, up to 19?
21.
45. I define child these days as anybody who's 15 years younger than me, so I can see adults and still say I'm practicing child psychiatry. But.
David, do you want to jump in?
Answer to that question.
It says child and adolescence, and so I think the preliminary goal, again, with the CPAN, you know, so I think the component of this that's relevant to the age group is the CPAN and the TCHAT component, right? I think I don't have a definition in law. I think, you know, if we say up to 21, I think people would understand, but I think we need to make sure that we're focusing on schools. Andy, you have?
Yeah, the last word you said, I think, is the critical one. I think we all need to remember where this bill came from. This wasn't designed to let us all, you know, do whatever we want for anybody we can define as a child. This was really set up in response to what was happening in our schools. And so it was the schools impacted by Hurricane Harvey, and then it was, you know, what we saw happen at Santa Fe. So I think the desire to help school-aged children was very much the dialogue of this. SB 11 is very much focused on schools. So I think that the safe bandwidth for us is school-aged children. And then I think if we want to make arguments for either going younger or going older than 18, then we just need to reference that.
Yeah.
Yeah, I mean, one would be like, for instance, lots of high school seniors are 18. We assume that we're going to include them, I assume.
Exactly.
And people with developmental disabilities stay in the school system until they're 21. And then finally, at what point, if you're in Head Start or pre-K, which is part of the public school system, does that include them? So there are a lot of practical issues around this.
And I'd like to at least pitch to think of universities up to 22. I think we were just talking about this. Correct me, the people are better at this than me. I think CHIP cuts off at 18. So I think we've legislated not directly, that we think people over 18 are not kids anymore. And I would strongly advocate that that's the wrong thing to do, and we should use this as a chance to start leveraging some change in the state. So let's be visionary as we do this and not allow ourselves to get statutorily limited when we know better. And so I would encourage us to think a little more broadly and not let CHIP define it for us. That's right, isn't it 18, CHIP? Yeah.
I agree that we need to be a little bit flexible about it rather than having a clear definitions right now. I think it depends on the program. And I think what have to drive that is mental health outcomes and programs. For example, if we do longitudinal program and we enroll somebody who is 17, but we want to see overall outcome for 2 or 3 years, we should not exclude them because they hit the 18. So to me, from my perspective, that was an example. So I would suggest that we be pragmatic about it and we think about it as a child psychiatrist and not as legislators.
I think if we're focusing on supporting schools and supporting the pediatricians, and if there's a 20-year-old child in a school, that's well within bounds of what we need to do. I think where we will need to get some additional approval if we decide we're no longer just supporting undergraduate schools, but are now doing community colleges, universities. That's a little bit broader than what the bill is to support those schools and pediatricians that are taking care of kids. Andy, is that fair?
I think it's fair, but exactly. And so I want to, yeah.
Covering them.
Yes.
Yeah.
In the state of Texas, if we could cover a quarter of the resources we have. I think with these projects, we need to be realistic as to what we can do. So expanding beyond school-aged children, it would be for another moment in time, not this one.
I think we need to do these things well, and then figure out how we build upon
Yeah, I'm
it.
going to take Dr. Wagner said it. I mean, but just let me take the opposite tack I did on the vision statement. This is where we need to set limits. And I'll just tell you, the budgets for CPAN, when we were running the numbers with people, were done on school-age children, ages 6 to 18. So that's when there were formulas set up. Now, those formulas aren't part of law. We could always go back and do whatever we want on that, but I think if we don't do a fantastic job with school-aged children and really make something that ultimately will be available to all of them, that's really job one. And I think it's not about trying to be legislators, it's trying to honor the intent of these funds and to do what we were told to do.
Andy, that was 18 inclusive?
It did include 18. Yeah.
Including 18.
Yeah, but I mean, those are not forced, those are benchmarks, they're reference points, but just, per Dr. Wagner's point, it's a lot of people. It's 5 million children.
So, to avoid alienating pediatricians, I would just as soon have it preschool through, because the pediatricians, they're very vexed about what to do with the preschoolers, and I think that for our money, it's early intervention, and it's not a whole lot of extra work in my judgment. So I could see.
I think, again, the CPAN to support the pediatricians and these issues. Again, well, the work group needs to figure out how do we do that, but it's the goal there is support the pediatricians in caring of these kids.
And I would say, too, there's a practical point. I think Israel was saying this, and I think very much, Joseph, goes with what you're saying, because if a pediatrician calls in, we need to help. And I think, too, if a pediatrician, calls in from a catchment area that's not in your catchment area, you're going to need help. I think so. The erring on the side of that is absolutely part of the intent.
So, as a practical matter, there are special education services that do see younger than your standard kindergarten age of entry. There are programs.
I would argue more concern about the upper limit, and I'll give you a very specific example. Texas A&M has 60,000 students on campus, undergraduate mostly. Majority of them, or all of them, are told if you have a pediatrician that's taking care of you for mental health problems, do not let it go and keep going to this person, because we don't have the capacity to provide you any help. So all our students who receive mental health, actually the majority of them, go to their original pediatricians, and majority of them are in Texas. So that's what I'm trying to say, that this issue, if we think about it, we are helping pediatrician and the kids who are in the system. That's what we're doing. And if we start setting up a specific age limit and judging by that, we're going to lose. And I'm sorry, but this is my constituents, similarly to kids who are 6 or 7 or 8 or 9 years old, and I don't think that having students with no services for eating disorder, substance abuse, or anything like that is appropriate or less troublesome than not providing pediatrician other advice to younger children with ADHD.
Annette?
So clarifying again, children and adolescent is the language of the law, correct? With no specified age.
No specified age.
Right.
Child and
And
adolescent.
Clearly, the merging of SB 10 and 11 created some, additional constrictions around the rule. But it seems to me that we would be far better off not identifying specific age, because there will be variation across different services. You have transition age youth, you have pediatricians who continue to treat young adults who in some programs, including in schools, continue to be part of that. So it seems to me that we can keep that focus on children and adolescents, recognizing that there will be those circumstances in which the age may go a little earlier than we might set here or a little later. We've got a lot of young children in early childhood intervention, for example, who have mental health conditions that really need to be a part of this, and those children are often seen by pediatricians. And I wouldn't want to see us get so constrictive that we find ourselves trying to identify a particular date and then excluding a group that really needs the attention. Foster children also comes to mind. You've got Medicaid program that's covering children who are in foster care longer, giving that option for them to continue receiving their care from the physicians that they are getting their care from. And I would think that the legislature, even with the intent of focusing this on school-age children, would understand why we would encompass those kind of circumstances in this work.
Yeah, I want to support Danette's interpretation, because if your language is taken straight from the thing, which I assume it is, for CPAN, not for the TCHAT, but for CPAN, it says now we're actually not serving patients, we're serving pediatricians and primary care providers for children and youth. And youth is doesn't have a clear upper limit, although usually we think of it as 25. I think as long as we stay focused on that, we're going to be fine.
Yeah.
And to Karen's very good point, it's a limited amount of resources, and so we're going to have to just try to put our money where the biggest bang for the buck delivers, and that'll be part of this group's responsibility. Is do you get a bigger bang for your buck managing 15 to 17-year-olds or 6 to 8-year-olds? And we'll have to make that decision.
And I'll just throw one pragmatic consideration out there, that it's very possible that one of our metrics will be the number, the individuals who we triage who end up in appropriate follow-up care. I think if we're endeavoring to now, say for argument's sake, somebody proposed going to 25 just for the heck of it. Now you're really, you're encumbering yourself with a much bigger, a much greater issue of securing services for, a whole other set of systems that I don't think we really want to do straight out of the gate. That's just my opinion.
All right. So I, again, would ask the chairs to work through that. I think, again, if we focus on kind of functions of supporting pediatricians, primary care providers, function of supporting schools, fellowships, local mental health authorities, we'll be okay. And I do think, Joe, that it reminded me that we need to be, for each of the chairs, at the very beginning, thinking through what the metrics are and what are the measurable metrics. I think some of the metrics at the beginning will be more output metrics of getting these stood up, but we need to think through what some of those metrics are and It did come up during the hearings of how do we measure success. I think we can lay out some of those output metrics, but also, I think there will be measurable outcome measures. We just need to be careful how we define those, things like waiting lists to get into a psychiatrist, et cetera, that we can start laying them out. But we'll task all of you in your work groups to put metrics kind of front and center and try to figure out how do we measure success in each of these programs. All right. I think that brings us to the very end. I think we actually, Nagla told me that we have a meeting scheduled on people's calendars for October 4th. I think we'll probably need to see if we can get something, might need to see if we can get something before that. Actually, that's
6 weeks.
6 weeks.
That's 5.
What's that? Earlier. I think we're going to need to put something earlier, and so we'll work to try to get it.
And then.
What's that?
Keep the meeting on the 4th, but add another one in the middle of September.
Yeah. See if we can put another meeting in between. Location of the future ones, it'd be my plan, and love our hosts and appreciate being here at the Higher Education Coordinating Board, but I'm sure they have a lot of calls for this room, and so we'll plan on hosting the future meetings at the University of Texas system as part of our responsibility. Food is very good.
It was very good.
Okay. All right. Anything else before we adjourn? Hearing none, appreciate everyone being here and look forward to the great work that you will be doing. Thank you.
Thank you.
I told him that when we have meetings